This video is looking at creating a disease register in HealthOne using hypothyroidism as an example. The first thing you need to do is to find the patients who have or potentially have hypothyroidism, and then you need to put them into your register. I have created inside in the population analysis, which is here, perform database analysis, a group called thyroid. The first group here is simply those who are already registered as having thyroid disease. If you edit this, you can see that all I am looking for is any patient where either the item problem or medical history contains the term hypothyroidism. If I run this, it finds 3 patients who have hypothyroidism recorded in one of those 2 items. The next search I created was to find those patients who may well have hypothyroidism but are not on the thyroid register. If you look at this, it basically looks for people seen in the past 3 years where they have the repeat prescription content containing altroxin or neomercazole, or the item assessment containing hypothyroid. I've excluded for this one patients who are likely not to be practice patients, and I have excluded those patients who are already on the thyroid register. If you run this analysis, it finds 1 patient called hypothyroid not registered. I can then add that patient to the register if I so wish. So we'll do that. We'll find that patient called hypothyroid not registered, and we will add them to the register. So by opening up the patient, we go to their summary page, and into the item problem, which is where I generally put it, we put the term hypothyroidism. I look in the database which comes up, and luckily it's already in that database. I enter on it, and as you can see, not only does hypothyroidism come up, but the coding ICD-10 and ICPC also automatically comes up. This has now been added to this patient. If I close that patient and save him, that patient is now registered on the hypothyroidism register. The next thing I want to do is do something useful with patients who have hypothyroidism. So for my audit for the year, I'm going to check if there are any patients who have hypothyroidism who have not had their TSH checked in the past 12 months. To do this, the first thing I did was I created an analysis to search for patients who have a TSH done in the past 12 months. So these are patients who have a consultation date less than 1 year into the past, or in the past year, who have an item TSH that exists. If you test that, you find that there are 2 patients, and as we saw earlier, we have 3 patients on the register. We should now have 4 patients on the register, including the patient whom we have just registered. But only 2 of these patients have a TSH in the past 12 months. The next analysis I created was one which searched for all the thyroid patients. So it basically finds all the thyroid patients, those with a medical history content containing thyroid or problem content containing thyroid. And it excludes my previous analysis, which is those who had a TSH done in the past 12 months. If I run my analysis, I find the other 2 thyroid patients who have not had their TSH done in the past 12 months. Thank you.